The electronic medical record is defined as a set of patient information, their health status, including the medical care and treatments they received, maintained electronically and stored in such a way that they can be used by multiple health professionals integrated into a network. Commonly called medical records, it is considered an essential document for the care of individuals about their health and must provide all the necessary information to ensure that, through this, efficient care and continuity of treatments provided to the patient are possible. It is also necessary to think about integrating the electronic patient record with other systems and equipment. The use of standards helps ensure that the data in the proposed system is structured to the point that it can be understood by other systems. With this, the need to use standards also emerged in the health area. They can be classified into patterns of identification, communication, content and structure, representation of clinical data, confidentiality, security and authentication, quality indicators, datasets, and guidelines. New ECO proposes an intelligent model for a patient's virtual medical record. The main idea is that each person can have their medical record in an application with their entire history of medical care. The data would be owned by the patient and could be made available to doctors during consultations in a super app. At the end of each service, the medical record would be updated through an automated integration process with the clinic or hospital system, permitted by the use of protocols used in the healthcare sector. The model stores information and concepts within a knowledge base through a system of intelligent agents. New ECO's main objective is to develop personal knowledge bases with graph.md integrated with Next.js. Using the Neo4j Graph Data Science API together with machine learning in Python with Apache Spark and Kafka tools. We are specifically interested in some of the best graph visualization APIs to provide interactivity with the company's personal GraphDBs. Knowledge Synthesis Platform. The basic idea is to provide a unified electronic space for people to store their personal information in intelligent GraphDBs. To achieve this, we created the new Eco digital ecosystem, and with the intelligent agent algorithms in the knowledge synthesis console, we want to bring added value to the diagnostic process. A differentiator of the project is the preservation of clinical data in the patient's knowledge base, with the possibility of making relevant data from previous consultations available, integrated with data from modern monitoring devices, such as smartwatches, recording heartbeats over the last 3 years. From there, entering the universe of more sophisticated cross-sectional analyses in the timeline. Not only the present but with the past, projecting the future directly into the graph with the prediction of edges, without the need to restrict AI in a dataset. We note that this is the highest level of current artificial intelligence. We are particularly interested in using timeline support integrated with the parameters generated by GDS. In this way, we intend to use the timeline visualization functionalities associated with the predictive parameters generated by AI, thus providing possibilities for choice and future simulation, to show users the positive impact of changes in their current behaviors. For example, we want to show the positive impact on a person's health if they change their current parameters for healthier future habits. This example can be used for different areas in people's lives: nutrition, supplementation, sleep, education, sports, and relationships, among others. Thus, the focus would be to use the timeline not only for the past but also for the future. In the new Eco Telemedicine project, certification standards for electronic health record systems are used. An important standard applied in the synthesis of clinical knowledge is HL7, an international protocol for the exchange of electronic data at the application layer in all healthcare environments, defining not only the message format but also their content, according to the circumstances in which they communicate. This protocol will be used to exchange messages containing patient information for healthcare institutions to enable medical consultations to be carried out. Our technology will provide dynamic forms for interaction between doctor and patient in synchronous and asynchronous communication across these different healthcare systems.